A patient bed location is defined as a location of the patient's sleeping bed or the bed or procedure table of a critical care area. Patient care related electrical equipment is electrical equipment that is intended to be used for diagnostic, therapeutic, or monitoring purposes in the patient care vicinity. And a patient care room is a room wherein patients are intended to be examined or treated. And then a patient care vicinity is a space within a location intended for the examination and treatment of patients. Real only patient care vicinity we have here is the way PT is set up. That would be classified as a patient care vicinity where their office is. They came in for the power strips and they said if they meet the UL standard, either one of these, that you can use them. If you go in and you rebuild a room and it's been renovated, you have to have a minimum number of receptacles. That's how they're getting rid of these power strips being used. As of right now, we're still fine. It is written that they may not be used in patient care vicinity to power non-patient care related electrical equipment. That would include computers, things of that nature. But they may be used outside of the patient care vicinity for both patient care related electrical equipment and non-related. So in your offices, if it's separated from patient care, you're fine. But we do want them to be hospital grade power strips. The power strip, I think y'all understand what they are. They're different than like these. The power strip, some of your equipment you have on a cart, they have a power strip attached to it to where you can plug the equipment into it. They have to be permanently attached to the equipment, and the sum of the ampacity cannot exceed 75% of whatever it's rated for. It has to be verified and documented that that's integrity, safe, and there has to be a means to ensure that nothing non-medical can be plugged into that. And I'm not real sure how you would ever do that unless you plugged everything but the one someone was plugged into. We don't really have to worry about any of that. A lot of that doesn't really mean anything to a lot of people. That's more centered towards us. We have a lot of things we have to watch. I know a lot of times people think we're being grumpy, but some things just can't be changed. We don't have the means to do it here. Any questions? I'm done.
Is Lincoln in here?
Lincoln's back there.
Do you want me to do mine or you want to do yours? It's okay if I stand here? Or would you like me up front?
Back there would work better.
You really don't want an up front picture? Well, I'm gonna have to go around. Can you sit there and just open up one that says safety plan?
Right now?
Yeah. Or when you cue it?
It's just easier to keep it going.
Okay, safety data is the next one. I do have a 5-minute video that we'll do in just a moment. We're required to train you on this
Turn the lights on if you want.
Sorry.
So, till we turn it there. Thank you. Thank you.
We're required to train you on this once a year. It's effective as of June 1st, 2016 that we do safety data. Your companies, is it next year that they have to be completely compliant? 2017? So you'll start to see SDS coming in as you get them. We need to get them changed out. There's still some old MSDS that are coming through, but we're required to start changing them over. Any questions on that, why we have to do that? No? Chief Courtney? Thank you.
We live in a world of chemicals. Our bodies produce and use chemicals. Plants and trees produce them. Even water is a chemical compound. Other chemicals in our world are man-made synthetic compounds. Although we don't know exactly how many man-made chemicals are in use today, experts generally agree it could be more than 100,000. Gasoline, paints, household cleaners, detergents, toiletries, wipes, solvents, everyday products used in home or work are made of chemicals. Before using any chemical product, you should find out all you can about it, and this information is literally at your fingertips in free publications called Safety Data Sheets, or SDSs. OSHA's Hazard Communication Standard requires chemical manufacturers, distributors, or importers to provide safety data sheets, formerly known as Material Safety Data Sheets, or MSDSs, to communicate the hazards of chemical products. All safety data sheets are required to follow a specific format and provide detailed information in 16 different sections. To protect yourself, your coworkers, and your family members, here are the top 10 things you should look for on a product's safety data sheet. What is the emergency phone number? If someone is injured, hurt, falls ill, or poisoned by a chemical product, who would we call to get more information? You can be sure emergency medical personnel, especially physicians and nurses, will want to see the safety data sheet. The manufacturer or distributor's name, address, and phone number is required to be right up front in Section 1, along with 24/7 emergency phone numbers. What is this product recommended for, and are there any restrictions on its use? This information is also required to be included in Section 1. How dangerous is this product? Statements like causes irreversible eye damage, highly flammable, and can cause central nervous system damage appear on safety data sheets even for seemingly harmless everyday household products. Section 2 is called Hazards Identification, and it is required to include all hazards regarding the chemical. What do you do if the product gets in your eyes, on your skin? What if you inhale or swallow some? Section 4, First Aid Measures, lists the signs and symptoms of exposure to the chemicals and whether the effects are usually immediate or delayed, and the appropriate first aid measures to take. If the product is accidentally spilled or otherwise released from its container, how do we clean it up? What materials can we use? And how do we dispose of everything properly? Should we wear masks or gloves? Eye protection? All this should be listed under Section 6, Accidental Release Measures. Are there any specific cautions we should be aware of to make sure we are safely handling and storing the containers of this product? Is it dangerous to store in certain places or near other chemicals or products? Does it have to be in a temperature-controlled environment? Section 7, Handling and Storage, provides this information. When using this product, what personal protective equipment should we be using? Should we use special gloves, splash goggles, or protective clothing? What should we do to prevent exposure to any hazardous chemicals in the product? Will we need to provide extra ventilation? Section 8, Exposure Controls, Personal Protection, tells us what we need to do to engineer a safe environment when using the chemical. What does the product look like? What color is it? Does it have a distinctive odor? Are the vapors heavier or lighter than air? At what temperature will it ignite? Is it an acid or alkali? Section 9, Physical and Chemical Properties, lists the chemical characteristics we should know. What other materials should never be mixed with this product? Can it become unstable if exposed to heat, light, or anything else? Could this product react with other materials like metals, causing it to decompose into a dangerous hazardous chemical? Some chemicals, when combined with certain others, can cause an explosion or fire. Section 10, Stability and Reactivity, outlines these cautions along with any known hazardous reactions. One of the most important sections of the SDS is Section 11, Toxicological Information. Could repeated exposures to this product cause allergic reactions? Are there any short or long-term health effects to exposure? Is this product associated with birth defects? Can exposure cause genetic mutations? Can it affect reproductive organs or the development of a fetus? By what routes can this chemical enter our bodies? And is anything in this product known to promote or cause cancers? Section 11 outlines this important information. When working with chemicals, we can never have enough information. Get the safety data sheets and read them thoroughly. Protect yourself, your coworkers, and your family.
You like it?
Okay, so you're going to hear a lot of things tonight, but what we're going to talk about here is actually one of the most important things about being a volunteer. We hope that you remember everything we tell you, but if you're going to pick just one thing, this is it. Okay. How to avoid being eaten by a hippo. What? What's wrong? I want you to talk about HIPAA. Right, HIPAA. It's short for hippopotamus. No, that's not right. Let me see if I can explain this to you sometime. Look, a guitar. Let me see if This is a little something like to call the HIPAA song. H is for health, I is for insurance, P is portability, and A accountability. HIPAA protects the patients, it keeps their info safe, it ensures that what you see here does not leave this place. Oh, I think I get it. If you see a famous person, or just an average Joe, what happens to them here is for no one else to know. You got it. What you see here, what you hear here, must remain here when you leave here. Everybody move, people in the back. What you see here, what you hear here, must remain here when you leave here. One more time, make it loud. What you see here, what you hear here, must remain here when you leave here. Audience participation wasn't as good that time, but...
Okay, sounds pretty simple, right? But unfortunately, we have to go over boring stuff because that's just what's required. Okay, so they started working on this in 96, 99, they finally passed it. 2003, it was more. They made the final rule and they started monitoring. Covers health plans, healthcare, clearinghouses, and those financial and administrative transactions electronically. Self-administered employee health benefit plans and plans with fewer than 50 participants are excluded. So what is information? Collected from an individual that is created or received by healthcare provider, health plan, employer, or healthcare clearinghouse. Relates to the past, present, or future condition of the individual, the provision of the healthcare to individual, that which identifies the individual. So, name, birthday. PHI is all individual identifiable information transmitted or maintained by a facility regardless of the form, so it can be electronic or paper. Patient name and diagnosis, count number, charges, home address, financial class, any information from the patient's medical record, and their CPT codes and ICD-9 numbers. Covered entities must have reasonable efforts to limit the PHI to the minimum necessary to accomplish the intended purpose of the use. Minimum necessary does not apply to treatment purposes, to the individual disclosure to the Secretary of Health and Human Services required by the law. So basically this part is saying that we can send information to and from doctors, to insurances for billing purposes. When we report stuff for QI, all that stuff is, we're not doing any violations because it's okay to do that. Patients have civic rights. Providers and health plans are required to give patients a clear written explanation of how the covered entity may use and disclose their health information. Patients are able to see and get copies of the records and request amendments. So to do that, if somebody comes in and wants their records from the clinic or from lab or wherever, that all has to go through medical records. They have to sign a release giving, that's saying that they're taking it out of here. We can't just give them their lab results because they have to sign a release that they're taking them.
Lincoln, you may speak up just a little.
People have the right to file a formal complaint with covered provider health plan or with HHS about violations of the provisions of these rules. So if they feel we're violating their rights, their HIPAA privacy, they can turn us in. Uses and disclosure of acknowledgement and authorization of opportunities to agree or object is not required. Besides, you can read that. So the penalty, so it can be up from $100 all the way to $25,000 per person. So if you're individually found guilty of a HIPAA violation, it can be anywhere from $100 to $25,000. If a facility is found guilty, it can be up to $250,000 per violation. Okay, so these are true or false questions. If I want to know a member of my family's PHI, I can look the information up in the computer. False. Right. HIPAA rules and regulations state that you may not access any information that you do not need to know to do your job. True or false? I am speaking to a group of hospital employees about new treatment options for our patients. It is appropriate to mention patient by name and who have used specific treatments for their medical condition. False. You're violating HIPAA by sharing, that's not on, PHI without authorization. There's nothing wrong with discussing patients in the dining room. You're all bound by HIPAA.
False.
Yes. Prohibit discussing confidential information in a public area where the public could overhear the information. It is not necessary to log out of my computer when I leave my desk. I'm coming right back.
False.
HIPAA regulations define leaving your computer unattended while you are logged in as a Class 1 offense. True or false? It is alright for me to ask my coworker if I can use his or her login information since I am unable to access the information I need.
False.
Sharing computer access codes are a Class 1 offense under HIPAA rules and regulations. You may not share your access code with anyone. Especially clinic doctor follows the patient out in the waiting room while continue to explain the patient's condition. Does this constitute a breach?
Yes.
Yes, because they're discussing it where it could be overheard. Your sister's best friend just had surgery and she wants you to find out how he's doing. What should you do? Ask a nurse on the floor, log into the record, or explain that that's a violation and you can't do nothing about it. Yep. The provider is very busy and asks you to log into the clinical information system using his or her ID and password to retrieve some patient records. What should you do? It's your boss, so it's okay. Ignore the request, decline the request, and refer to facility HIPAA security policies.
C.
You can protect patient information by protecting verbal or written information, utilizing safe computer skills, reporting suspected security incidents, are all of them.
D.
You find patient information in the conference room. What do you do with it? Notify housekeeping to come and clean it up. If you can identify who left the records, return the records to them, or take the records to your privacy officer.
C.
And who's your privacy officer?
You.
Me. Right. A local television star is a patient. Your facility administration asks you to check the medical records to see if the patient treatment was successful. What should you do? Access the record but do not share the information. Look at the medical record and share only the information that you know is public record. or explain that you're not allowed to access the information unless you need to provide care.
C.
Compliance